Hi friends, Dr. Nancy Trimble here. Today we're going to be talking about the 3 reasons for vertigo and dizziness. And by the way, we are putting the power and knowledge of your health back in your hands. So it is true. If you have a brain tumor, one of the symptoms that can happen is dizziness or vertigo. So if you think you may have a brain tumor, please find your appropriate healthcare provider to help you know if you do or do not and seek appropriate treatment. So today we're going to be talking about the 3 reasons for dizziness and vertigo that are neuromusculoskeletal in nature, meaning if you get body work done, you're going to fix this problem for yourself. The very first reason could be that you have an inner ear canalith issue. This is the one that they call top shelf syndrome, which means when you look up into one side, the room starts spinning. If you keep your head very level, chances are the vertigo will stop. So this is because there are inner ear canals that have fluid in them, and those canals also have these little hair-like projections called cilia, and they send messages to your brain to let you know where your head is in space. Well, unfortunately, sometimes the fluid starts to crystallize, and then those crystals bang into those cilia and cause your brain to get incoming information that's incorrect. So your eyes tell your brain where your head is in space, but your ears are saying something completely different. So it causes that mix-up, and that causes that vertigo and dizziness. So there are very specific exercises you could do for those. They are called the Epley maneuver, and there's another one called the somersault maneuver. These are things you can do on your own. Now keep in mind, generally they will help because there are 3 canals on each side and they point in different directions. If you've got the most common canal, then you could do those exercises and it will help. You may need to seek a physical therapist who specializes in vertigo and dizziness to help you if these maneuvers do not work, if your problem is from the inner ear. The second kind of vertigo and dizziness, or the second source, could be these muscles. These are the SCM muscles because they start at your sternum and clavicle, SC, and go to the mastoid part of your skull, SCM muscle. It's these muscles that are on the side of your neck. These muscles can get trigger points from stress, from being out in the wind, from being in the water when you're straining to keep your head above water. So these muscles can get trigger points. I talk about trigger point therapy in another video. And the way you're going to work on it is you're going to grab hold of that muscle, turn your head to one side, and you're going to find that trigger point. Now you may notice as you hold pressure there, you feel a little dizzy because you're activating that trigger point. That's your second source of vertigo and dizziness. The third source is something your chiropractor can help you with. It is from subluxations that occur in the upper neck, and these subluxations, especially a very specific rotation of the first cervical vertebrae, will interrupt the normal neurological function of your brainstem, balance and coordination center of the brain. And so getting a chiropractic adjustment is going to help to fix your vertigo. So I don't know what the source is of your dizziness or vertigo, but there are very specific things you can get done with body work to fix those. So if you enjoy this video, please subscribe, follow us on our other social media platforms. This is Dr. Nancy Trimble putting the power and knowledge of your health back in your hands. Bye for now.